Well, it's a headline number, right? 1 billion, 100 crores. It's a significant number. It's a significant milestone, and it grabs attention. I also do have to add that there's nothing to actually take away from the feat, considering we've managed to do this in less than a year, about a little more than 9 months or so. Our vaccination program started only in January of this year. You're right about the number of people who need to be vaccinated with both doses. If you actually break down that 1 billion number, you will see some disparities. So when it comes to eligible adults in our country, only 75% have been vaccinated with one dose. If you look at the numbers of double doses, that number is actually just 30%. So there is a larger, very important goal staring at us, that is to make sure that the eligible adults in this country are double dose vaccinated by the end of the year. And if we had to do that or reach that sort of significant milestone, we would have to pace up our vaccination. Possibly, if you were to break down that 1 billion number a little more, you would realize that we have managed to cross that 1 billion mark because we had to stop exports of vaccines to some of the low and middle income countries. We have started that now again, I think, earlier this month in October.
Yeah. So what is the supply, though, for those additional people that you're needing to try and get double vaccinated by December? Are they on track, or is there a reluctance? Has it just been dropping off in terms of people going forward to get the jab?
So I think in India, vaccine hesitancy is not what you would see in many other parts of the world. Even if you were to break down this 1 billion number, there is nothing or very little evidence to suggest that people in rural India are not getting vaccinated. There may have been a little bit of vaccine hesitancy at the start of the vaccine program among healthcare workers, but that's not something that has stuck the ground. If I was to answer your question as to what's going to happen in the next couple of months, obviously the pace of vaccination has to improve. There are some regional disparities. Some states are doing better than other states. There is a gender disparity as well, but it's not very, very marked. As far as our population, about 40% of our population that's below 18, we are not currently vaccinating them. We don't have a vaccine for that. So that's one. There is also, the beginning of the festive season here in India. So you could possibly see a lower adherence to COVID-19 protocols in that sense. In fact, health experts have been sort of warning people, make sure, Prime Minister warning as well, make sure mask up as well. There is also sort of a slight complacency since we're having low infection numbers at the moment. So health experts have warned that people are sometimes not coming for their second dose or are wanting to push that. So all of these factors need to be taken into consideration to make sure that we reach that number of fully vaccinated adults by year end.
Yes, because the picture is so much better in India compared to what it had been earlier this year with that terrible second wave that you endured. Are communities sort of adapting their living styles and managing some of the risks themselves?
The second wave of COVID-19 that happened earlier this year, let's say March, April, May, June, actually sort of exposed the public healthcare system in India. We were almost gasping for breath, both literally and figuratively. India is such a vast country that to be able to draw a broad brush argument as to whether people are really managing by themselves or have changed behavioral patterns is really something tough to make. But you will see in cities there is a greater adherence to COVID protocols. People are wearing masks. There isn't too much of questioning around masks, etc. You would see possibly still people maintaining some amount of social distance in cities. But as I said, the festive season is a season where you'll see possibly larger crowds, more traffic on our roads, etc. When you go down to some of the rural stretches, you will find a density of population that gets scattered. People may not be wearing masks so much, but I think in terms of whether there is a knowledge about the mask or whether there is hesitancy around COVID-19 vaccines, I think it would be manageable.
Yeah. And are there messages going out regarding the season coming up, the nervousness around another variant, another wave?
So far, I think the one message or one prominent message that really has come in from the government and the Prime Minister around the upcoming festive season, right? This is a matter of worry of sorts. You'll also find that in rural India, the government had actually made the first dose mandatory if you had to access welfare programs. Now, there has been no such requirement that has been made for the second dose. So when you actually consider that people in rural India do have to travel a longer distance to access the second dose, you could find a problem there. There is sort of messaging, or there is at least communication that is going around. We haven't quite made a decision on that about Covishield and having a 3-month gap, right? So a large number of people are due for their second dose in the coming weeks. They got their first one in the summer, so our numbers might actually end up improving. The messaging really has been around this, but I think everyone's sort of making the calculation in their heads that we had lowered our guard around this time last year, and then we saw the second wave come in about March, April. So I think there is a broad realization of this, but we haven't had messages beyond the festive season at least go out. The government, I must say, at this point in time in rural India is now deploying very different kind of messaging that's more in line with our sort of with respective regional cultures, etc.
Interesting stuff, Anubha. Great to talk. Thank you so much.
Thank you for having me.